Sign of internal bleeding include. The correct option is option B, tachycardia and hypotension. Antacid should not be taken with. The correct option is option A, digoxin. Preeclampsia is diagnosed by. The correct option is option C, proteinuria and hypertension. Which behavior suggests effective coping? The correct option is option C, problem solving. Which term means false belief not based in reality? The correct option is option A, delusion. Which drug is a common NSAID? The correct option is option A, ibuprofen. Which medication is a bronchodilator? The correct option is option A, salbutamol. Vitamin K is given to newborns to prevent. The correct option is option C, bleeding. Lithium is used to treat. The correct option is option C, bipolar disorder. One of the earliest signs of Alzheimer's disease is. The correct option is option B, memory loss. Dot strategy is related to. The correct option is option B, TB treatment. At how many weeks is a fetus considered viable? The correct option is option B, 24 weeks. A patient receiving heparin should be monitored for. The correct option is option C, APTT. Which is a side effect of corticosteroid? The correct option is option C, immune suppression. Which method is most effective for birth control? The correct option is option B, IUD. The vector for malaria is. The correct option is Option B. Anopheles mosquito. First sign of puberty in girls is. The correct option is option B. Breast development. Which condition causes crushing chest pain radiating to the left arm? The correct option is option B. Angina. Which ECG change is seen in hyperkalemia? The correct option is option B. Tall peak T waves. Which diagnostic test confirms appendicitis? The correct option is option B. CT scan. Which is an objective sign of disease? The correct option is option C. Fever. The primary purpose of nursing documentation is. The correct option is option C. Communication among healthcare team. A patient with hyperthyroidism will most likely have. The correct option is option D. Heat intolerance. The principle of sterile technique includes. The correct option is option A. Keep sterile items at waist level. Which color container is used for sharp object disposal? The correct option is option C. Red. Which is most accurate method of temperature measurement? The correct option is option C. Rectal. The most important assessment immediately after delivery is. The correct option is option C. Newborn breathing and cry. The major goal of primary health care is. The correct option is option B. Preventive and promotive care. The expanded program on immunization EPI was launched by. The correct option is option B. WHO.